Why do people take vitamin D and K2? Vitamin D and vitamin K2 are fat-soluble vitamins that work together to support bone health, cardiovascular health, and immune function. While vitamin D is known for its role in calcium absorption, vitamin K2 ensures that calcium is directed to the bones and teeth, reducing the risk of calcification in soft tissues like arteries. Vitamin D promotes calcium and phosphorus absorption in the gut and supports immune regulation. K2, specifically the MK7 form, activates proteins like osteocalcin and matrix GLA protein, which guide calcium to bones and inhibit its deposition in arteries. This interplay is critical for maintaining bone strength and preventing vascular calcification. A 2017 meta-analysis in Osteoporosis International highlighted the synergistic benefits of combining vitamin D and K2 to improve mineral bone density and reduce the risk of osteoporosis. But the benefits are not limited to bone health. Vitamin K2 prevents calcium buildup in arteries, reducing the risk of arterial stiffness and cardiovascular disease. A meta-analysis published in Thrombosis and Hemostasis in 2015 found vitamin K2 supplementation reduced the risk of arterial calcification. Vitamin D supplementation enhances immune regulation, reducing the risk of age-related immune dysfunction and autoimmunity. It also reduces the risk of other chronic diseases like cancer, diabetes, and cardiovascular disease. Vitamin D deficiency from lack of sun exposure and vitamin K2 deficiency from lack of the intake of fermented foods are extremely common nowadays. Typical vitamin D doses are between 1,000 and 4,000 international units IU daily, depending on baseline levels and sunlight exposure. 3,000 units daily is a pretty good average for most people. A daily dose of 90 to 200 micrograms of K2, preferably the MK7 version, is commonly recommended. Often these two vitamins are sold together as a D-K2 combination. Both vitamins are very well tolerated at recommended doses, side effects exceptionally unusual. However, very high doses have been linked to high calcium levels in the blood and should probably be avoided without medical supervision. Vitamin D and vitamin K2 are safe and appear to address several of the underlying causes of chronic illness and aging. Are you taking vitamin D and vitamin K2?